Welcome back. Medical professionals have been on the front lines fighting COVID for over a year now. And according to multiple studies, it is really taking a toll. So, in this week's Your Best Life, I speak with a Dallas-based clinical psychologist about combating burnout and stress, especially if you're a frontline worker. A new survey on the mental health of healthcare workers right now is shining a light on just how much they're going through. 93% say they're stressed. 86% are experiencing anxiety. 77% report frustration. 76% are exhausted and burned out. And 75% say they're overwhelmed.
There are times in our life that we're going through something similar to our patients, but now everybody that comes in, we're all part of the same stories. We're all wrestling with some of the same issues. And so that really starts to take a toll on us, because those are the conversations that we have every day at work, and then we go home and have the same conversation. So it's like we don't get away from it.
Dr. Kevin Gilliland is a Dallas-based clinical psychologist who's been helping clients battle burnout during the pandemic.
It's always physical and it's always psychological. It doesn't matter what you do for a living, the symptoms look the same.
So what are those symptoms?
Sleep has been the number one thing that gets disrupted, especially in the midst of COVID. So we'll see it in sleep. We'll see it in our energy level. Like the things that we enjoy doing and used to enjoy doing, it's like we just can't get the energy to get it going. Psychologically, we get frustrated easier. We might be irritable. Our mood might be a little down, not depressed, but just down. Or we find ourselves getting hung up on a subject that we're worrying about.
To combat burnout, Dr. Gilliland says you need to spend a little time every day recharging your battery instead of waiting for weekends or vacations. One great way to do this is finding a hobby that requires your total focus, like reading.
What we're doing when we read is we paint a picture, we make a movie. And so it requires me to be really in it, or else I got to read that paragraph again. Whereas TV, I can worry and watch the TV at the same time. That's not good.
Dr. Gilliland also suggests asking your family to help you out.
It's about accountability, of telling a spouse or kids of, hey, let me know if I'm talking about this all the time, because I may not even be aware of it.
Now, if you are a healthcare worker and you're concerned about your mental health, there's a 24-hour crisis center that you can call or text. The number is 1-800-273-TALK, or you can text MHA to 741-741, and you'll reach a trained crisis counselor anytime, day or night. And again, we want to thank you for everything you are doing to keep us safe. You are all heroes. Meteorologist Jordan Darensberg joins me right after this break with a full check of your forecast. Don't go anywhere.